The process of pouring oil on the whole body with simultaneous massaging is called Snehadhara. It is of two types: dhara over the whole body except the head, and dhara over the whole body including the head. For a really effective Sarvangadhara, at least 5 people are needed to attend to the patient, but nowadays, usually only 2 people perform this therapy. Before starting the therapy, oil should be applied on the head of the patient. The patient is then made to lie on a dhroni, and 2 attendants each stand on either side. Nozzled mud or bronze pitchers, kindis, are used for pouring the oil, which should be kept warm throughout the course of the treatment. While the attendants pour oil with their right hand, they also massage the patient using their left hand. Dhanyamladhara literally means a dhara or pouring of a medicinal liquid called dhanyamlam over the patient's body. Dhanyamlam is a sort of vinegar obtained from the preparation of various cereals, citrus fruits, horsegram and dried ginger. Cereals with highly nutritious starch content like navra rice or millet are used. The dhanyamlam is poured in a small stream over the patient's body from a nozzled pitcher, kindi. Diseases caused by the derangement of vata humor are treated with dhanyamla. Pirichil, which literally means squeezing, is a unique contribution of the Kerala tradition of Ayurveda. Here, warm medicated oil is squeezed over the patient's body from a piece of cloth that is periodically dipped in a vessel containing the unction or kuramba. The unction used here is slightly more viscous than that used in Sarvangadhara. Trained attendants under the supervision of a physician perform the treatment. The attendants squeeze the oil with their right hand and simultaneously massage with their left hand in downward strokes. The patient should be made to adopt the 7 standard positions so that no area of the body is left uncovered. Though it is actually a process of sudation used as a purvakarma preparatory treatment, it has also proved to be highly effective on its own for treating diseases caused due to the vitiation of the vata humor, especially pakshaghata, hemiplegia, paralysis, muscle spasms, and other degenerative diseases affecting muscles. Upanaha Swedam or poultice is the local application of medicated paste to cure pain and swelling. Herbs, seeds, grains mixed with vinegar, buttermilk, medicated oils or ghee are ground to obtain a paste. This paste is applied hot over the affected part of the body and is allowed to remain there for over 12 hours. Avagaha Swedam is yet another form of sudation. In ailments like hernia, painful urination, rheumatism, and certain other diseases due to deranged Vata humor, Avagaha Swedam is recommended. In this treatment, the patient is made to sweat while sitting in a tub full of warm, medicated liquid. The level of the liquid filled in the tub is up to one's navel and sometimes up to the neck.
Bashpa means steam. It is also a sweat therapy. Here, herbal steam is evenly applied to the entire body. Before starting therapy, the person is given cool liquids to avoid dehydration. Then she or he is made to lie down in a steam box on his or her back, and the entire body, except the head, exposed to the steam. It is important to maintain the normal temperature of the head.
The principles of Panchakarma were first formulated by the great scholar saints of yore, Sushruta and Charaka. Though they propounded to different schools, their disciples codified their prescriptions and thus evolved a common five-fold therapy of the Panchakarma. They include Nasya, nasal therapy; Vamana, emesis therapy; Virechana, purgation therapy; Vasti, therapeutic enema; and Raktamokshana, bloodletting.